Good morning, folks. So I was sitting here putting together the upcoming promotion, and I was thinking to myself, how many of you actually know how to read a surgery quote? You wouldn't believe the amount of questions that I get and the types of questions that I get when it comes to the surgery quotes. So I figured, let me just show you because there's a lot of different types of quotes out there, but you gotta know what you're getting, what's fluff, and what's really the stuff that you want. Typically, quotes offer the same basic stuff and then tend to have a few VIP features or varying features and different fees. So let's take a look. This is a very popular quote from my roster, so let's take a look at it. It includes the consultation, pre-op evaluation, basic blood work. Notice they said basic. Cardiology evaluation, EKG, chest x-rays, anesthesia clearance, 1 night in the clinic, medication while you're in the clinic, the stage 1 FAHA. Serena then threw in 12 days of recovery, and your follow-up appointments are included. Now, let's take a look at what's not included. Here on the bottom, you're going to notice what's not included. So the first thing is complication insurance. The second thing is your lung evaluation and the CAT scan. The next thing is your blood reservation. Then your medications, your pain pump, and any additional specialist exams at your own expense. So if you're anything like me, I know you want to know what does this mean. So let's run through it real quick. The consultation, you have that with me virtually or with a coordinator or with the doctor's office or with whoever. Your pre-op evaluation is actually when you get here. It's when you actually see the doctor in person. Then they're gonna send you out for your blood work. Blood work is basic. There's pretty routine blood work that's requested of everybody that's gonna have surgery, right? But if you suffer from something, you're gonna have to have a specialized test, which is not gonna be included. Like, let's say you suffer from thyroid and your thyroid is not under control, or you suffer from a sugar issue and your sugar is not under control, or you suffer from anemia or sickle cell trait or anything like that, you're going to be required to get extra blood work done, and that's going to be expected to be covered by you. First thing. This is why it's so important to be honest during your pre-op evaluations and even your virtual consults, so when you get here, you're prepared. The next thing is cardiology. We all have hearts. They're all important. We need to see a cardiologist to make sure that your blood is going to be pumping through your body the way that it should, making sure that your heart is working under the right type of stress and all that kind of stuff so they can handle what you're going to go through. Because remember that surgery is a controlled trauma. Next, you're going to get chest x-rays and an EKG done. The EKG just has to do with your heart, making sure, again, that your heart has an appropriate rhythm and that it can handle whatever your body needs. Secondly, your chest x-rays, make sure that your chest and your lungs are clear. You guys know we went through COVID. A lot of people smoke. A lot of people have other habits like hookah, vape, and other things which cause congestion in the lungs. And I'm sorry, but hello, we need to be able to breathe during surgery. So that is one of the main things that we need to check. Now, remember, down below, it does say lung evaluation and CAT scan. We'll talk about that. That's for people that are having certain procedures or are suffering from certain things. But we'll get there. Now, the next thing is anesthesia clearance, because you have to be cleared by anesthesia to have surgery, but that can't happen until you get everything else done. Anesthesia won't even look at you unless all of your evaluations have been done and seem to meet the bare clearance. Then they'll receive them, then they'll look at them, and they'll make the final word. Because at the end of the day, no matter how much your surgeon wants to operate you, if the anesthesiologist is not on board, neither will you be. So other than that, when you stay in the hospital for surgery, you have to spend the night. So they are covering the room that you're going to stay in for the night. You're not going to be charged for that. Also, your medication while you're in the clinic. So after surgery, obviously they have to put an IV and they have to give you some pain meds to keep you calm, stomach protecting, things like that. All of that is included. You don't have to worry. This quote, I believe, was for a lipotummy tuck BBL. And so this quote actually included the stage 1 FAHA, which is the FAHA that they put you in right out of the operating room or right on the operating room table at the end of your surgery. So that was also included. Now, this was a Serena package that I had bundled with the surgeon. So we added 12 days, and this was a special. So this isn't always going to be there. But notice that it says 12 days recovery. The 12 days of recovery just means that you get 12 days stay, including the nursing care and including the meals. Doesn't mean anything else. All right. Then you've got follow-up appointments. Follow-up appointments are your follow-up appointments with your doctor. So let's say you need to see your doctor twice. You need to see your doctor 4 times after surgery. However many times you need to be seen until you go home, your doctor has you covered. So that's what's included in the price that you get. But you have to be mindful that the price that they're giving you is the price that's going to your surgeon to cover all of the evals you need, all the blood work you need, to pay their assistants, to pay for the operating room you're going to go into, to pay for some of the equipment they're going to use while they're taking care of you, to pay for your meds while you're in the hospital, the nurse that's going to take care of you in the hospital, that stuff, right? But then you've got things that you are responsible for, like the unincluded fees. So one of the first things that some surgeons include and some surgeons don't is complication insurance. So when you're looking at your quote and what's included, you want to find out, is the insurance included? Is it not included? And if you don't see it anywhere, you need to ask, just so that when you get here, you don't find yourself in a situation where you're like, oh shoot, I got to pay $300 extra for insurance. Yes, you do. Because one, if God forbid anything happens to you or you have any complication, you'll be covered for 30 days while you're here in the country, which is absolutely important. And number two, why would you want to have surgery at all without insurance or without assurance? Because here, you're not getting anything. And when I tell you anything, you're not even getting triaged in the hospital without paying at the door. So make sure that you have that $280 or $300 complication insurance money. Like I said, whether it's included or it's not included, pay attention. The next thing is lung evaluation and a CAT scan. So especially during COVID, everybody was required to have a lung eval by a pulmonologist and have a chest CAT scan. A chest CAT scan is much more profound and it looks a lot deeper than the x-ray, and it helps to, again, just make sure for congestion and make sure that you can breathe. This usually isn't done when you have to do a lipo BBL nowadays, but when you're doing lipo tummy tuck BBL, when you're doing mommy makeover, when you're doing anything invasive like that or longer surgeries, then they absolutely are getting done. So again, if you're not sure, if you don't see it, ask your doctor. Do I need to see, or your coordinator, do I need to see a lung doctor? Do I need to see a pulmonologist? How much more does it cost? And do I have to do any kind of imaging after seeing the pulmonologist, and does that have an extra cost? Because again, you want to be prepared. A lot of times they don't put these things in there and then you get here and you didn't count for them. So guess what? You don't have it and now you're thrown off. Whether you have to ask people to send you money from home and it takes a while or whatever, you get delayed and you get frustrated, which is not the goal here, right? So with that, I've said what I need to say. Blood reservation. Now, when you are going to have any type of surgery, any type of controlled trauma, any type of cutting, incisions, anything, you're going to bleed. Y'all, more than off of food, we live off of the blood that runs through our veins because it carries our nutrients, our oxygen. It's what keeps our tissues alive. So during surgery, you're going to be cut and you're going to spill blood. When you spill blood, you are spilling oxygen. The oxygen your tissues, your body, your heart needs to keep breathing, to keep you breathing, right? To avoid necrosis and other things. Now, if you lose a lot of blood during surgery for whatever reason, or just because you've had a lot of procedures, or your procedure time got extended for some reason, or maybe even you went in with a lower hemoglobin, you're gonna need blood. And here the blood needs to be reserved. It's not one of those things we're gonna go run and get. You know you're having a surgery, we're gonna reserve the blood for you. If you need it, it'll be there. If you don't need it, we refund it, okay? Then the next thing is the pain pump. The pain pump is optional. However, you should have a conversation with your doctor about what the pain pump is, how to use it, where to use it, and if you actually need it, do other people need it, you know, and make a decision based on your pain tolerance. But again, it's optional and you don't have to buy it. But notice that the price here is $300. I believe it's actually gone up already to $350. Different clinics offer it at different prices, so don't pigeonhole me to the price. I'm just sharing. And then you'll see at the bottom that it says additional specialist exams are at your own expense. So again, remember I told you, if for whatever reason you have a viral condition like HIV, herpes, syphilis, hepatitis, if you are a patient that suffers from, let's say, a regular illness like thyroid deficiency, iron deficiency, anemia, somebody that's suffering from elevated sugar, high cholesterol, things like that, then you may have to see an endocrinologist or a pulmonologist or like an asthmatic or something. You have to see the specialist that deals with your condition, and that unfortunately comes out of your pocket. But these are the things we have to pay for if we want to have surgery, right? So just put those things together and notice that you're going to have a surgery price, plus in this quote you've got $1,370 worth of extra expenses, which is super important for you to know. Why? Because when I give you an all-inclusive rate, I need you to realize that I'm going to start including those fees and I'm going to slash at them. So it's always going to be cheaper. But you got to know how to look at it and you got to know how to calculate it. This is my small spiel on how to read a surgery quote. If you want more info, let me know and I'll make a bigger video. Now that was just the basics. Stay tuned for part 2 because we have to talk about the fine print, which is very important, and the VIP add-on features that you can have, how much they should cost, what. So stay tuned.